good news in terms of healthcare in New York City, with Mayor Bill de Blasio announcing expansion to the city's public option program. It's a little bit complicated, but this seems like a pretty good change, at least initially. He tweeted, "Healthcare isn't just a right in theory, it must be a right in practice. Today I'm announcing a plan to guarantee healthcare for all New Yorkers through our own public option, and a new program called NYC Care will ensure the first stop for people isn't the emergency room." So let's give you some details about what this new program is actually intended to accomplish. The plan is dubbed, as we said, NYC Care. It's gonna offer public health insurance on a sliding price scale based on income. It will begin later this year in the Bronx and will be available to all New Yorkers in 2021, and would cost at least $100 million once it reaches full enrollment. There's not really the detail on this that I would like at this point, so I can't explain why it starts in the Bronx specifically, but it does, and it'll take a couple of years to roll out. It also there is described as health insurance, although Bill de Blasio and others have multiple times said this is not health insurance, these are direct payments for healthcare issues. That distinction is currently lost on me. We're gonna talk to some experts and get that down, thankfully. But it does come with quite a few benefits, actually. The proposed option would assign a primary care doctor to each plan participant and help patients find specialists if needed. Bill de Blasio said the plan would be financed out of the city's public health budget, would ultimately be cost effective by reducing hospital emergency room visits by uninsured patients and by improving public health. So this is significant, of course, because there's 600,000 people who hypothetically fit into the class of people who would have access to health insurance under this plan, which again is on a sliding pay scale. Hypothetically, if people were making the least amount of money, they might not pay anything at all for this.
So Johns Hopkins University just published the latest study on the cost of healthcare in the United States versus every other developed country. And they again reinforce something that we already know as people who follow the news, follow the statistics. The United States spends more on healthcare than any other country. And part of the reason why is, of course, the pharmaceutical drug prices and how Americans end up paying way more than anyone else. We're not able to negotiate the drug prices like other countries are. But more importantly, the first visit to a doctor for a lot of Americans is the emergency room. And that is incredibly expensive, incredibly costly. And I remember when I was growing up, I did not grow up in a middle class household. It was a working class household. My parents were both immigrants working really hard. And so they couldn't afford health insurance. My dad was doing odd jobs here and there at one point when he lost his job. And so California had a program called Healthy Families. And because of that program, me and my brother were able to go see a dentist every year or twice a year. We were able to get our annual checkup. And it kept us healthy, it kept us well. And I really appreciate that kind of program, which is why, for me as an American, I took advantage of something like that. And I feel like it is my duty, right, to make sure that other generations have the same access to affordable healthcare, to free healthcare in this case. It's not really free because you're paying for it through your taxes. I love what de Blasio is doing. I wish we could see something like this on a national level. I also want to keep following up on this story because I know he is looking to run in 2020, and I hope that this is a genuine effort.
Yeah, it is still absent some details. I mean, we do know that it includes both physical and mental health. Apparently it does not include dental. But I like, as you just did, he continually stresses trying to keep people out of using the emergency room as their first and last option, obviously. Because while it not only costs far more and leads to people having worsening of diseases and things like that, the stuff you just described about the healthy families and keeping yourself healthy, the emergency room is not an option for that.
That's right, yeah.
It only is once you get to the point of an emergency that you actually end up there. And so that ends up with not only spending more money, but also achieving worse healthcare outcomes as well.
2 easy ways to follow the Young Turks. One is hit the subscribe button down below, then you're a TYT subscriber. And second is ring the bell. And when you do that on YouTube, you're notified of our videos.